Hi, Robin. I'm so glad you came in for your annual checkup. Now that you turned 40 years old again, it's time for your annual mammogram. No, thank you. Mammograms cause cancer. That's not true. Who told you that? Oh, some doctor on TikTok. Don't you know you can't trust everything you hear on social media, especially if they're trying to sell you something? Well, first off, the dose of a mammogram is extremely low. The amount of radiation is equivalent to flying cross country or about 7 weeks of background radiation. The dose of a mammogram is so low, it's even safe in pregnant patients. But mammograms continue to play an important role in the early detection of breast cancer. They've shown to decrease mortality from breast cancer about 40%, and people who undergo routine mammography are about twice as less likely to die from breast cancer. No, thanks. I'm going to stick to QT imaging. Oh no. How about thermograms? Oh no. Whole body MRI?
No!
None of those imaging modalities are FDA approved to replace mammography. Let me repeat that again. None of those imaging modalities are FDA approved to replace mammography. Annual mammography continues to play a critical role in the early detection of breast cancer and has safely done so since the 1970s. Mammograms can detect calcifications and other subtle findings which may be the earliest sign of breast cancer that may not be detected on those imaging studies. It's fine. I have no family history of breast cancer, so I'm not at risk. And besides, I joined this doctor's detox, which will prevent me from getting breast cancer. So unfortunately, most people who are diagnosed with breast cancer have no family history or known genetic mutation. In fact, the two greatest risk factors for developing breast cancer are being female and getting older, which we cannot change. That being said, there are many great ways to lower our risk of breast cancer, such as maintaining a normal weight, exercising at least 30 minutes a day, eating a plant-forward diet, and minimizing red meat, limiting alcohol intake, and keeping normal vitamin D levels. But that being said, even if you do everything right, there is no way to prevent developing breast cancer, which is why early detection is the breast protection. Annual mammography saves the most lives. Fine, I guess I'll get a mammogram. Say, how do you know all of this anyways? I follow the Boobie Docs for the breast information.